Hey guys, how's it going? My name is Dr. Brandon Labe, as I mentioned. Thank you all for tuning in. I'm going to go ahead and start out by sharing my screen here. All right, so today we're going to be talking to you guys about how I've been able to create a highly productive practice as a newly graduated dentist. So just a quick little about myself. I went to dental school at University of Pennsylvania and then ended up graduating 22. Did a one-year GPR where I was a chief resident at Newark Beth Israel Hospital. And that brings me to my current location where I'm an associate dentist at Access Dental Dentures and Implants. We are a company based out in Missouri, and I am located out in Lake Ozark. So my first year of private practice, I was able to collect 2 times the ADA average, doing 30 hours a work week, and we're in a Medicaid-heavy office. So this year and this current year, I'm actually on pace to do 3 times the ADA average. So I'm going to kind of give you some insights today on how I was able to pull that off so early on in my career. So this is what we got on tap for today. We're going to kind of talk about, I don't have enough time to talk to you guys about all the different clinical skills I've been able to learn over the past couple of years through my residency and all the CE I've taken. But what I can teach you guys is about some of the soft skills that are required, which is case acceptance, learning how to effectively communicate with your patients, managing their expectations. And I'm also going to get into some methods on how to manage multiple chairs and schedule efficiently as transitioning as a new graduated dentist. So a little bit about why we care, right? So when we get into dentistry, some of us get into it to change our patients' lives. Some of us want the dentist lifestyle, the stable income. But the reality of dentistry is rapidly changing. And a lot of the times before we get into the actual profession, we don't realize what we're getting into. We don't realize how there's, the difficulties of dealing with staff and managing conflict, the difficult patients, rising student debt. What does it mean to take out, $500,000 to go to dental school? But again, a lot of these issues all stem from communication. Ultimately, communication is not an easy thing. They don't teach you these kinds of things in dental school. Unfortunately, there's just not simply enough time to teach everything. And you can learn all the hard skills, how to do great surgery, but ultimately, if you can't get your patients to agree to treatment, then you're not going to be able to apply those skills. So one could argue that your bottom line is almost more affected by how you talk to your patients, right? And again, when we think of a good dentist, most of us probably think of someone who has beautiful crown preps, can place great implants. But ultimately, most of your patients really have no idea what your crown margin looks like versus somebody in dental school. What they can tell is, how are you making them feel? Do your injections hurt? Are they sore after your procedures? Again, these are the kinds of things that ultimately are going to make the difference between you and the person down the street, because this is what the patients care about. Furthermore, we want to get into the root of what does it take to get a patient to say yes to whatever you're proposing. When you're telling a patient that they need to get a crown done, most of the time they're thinking, that $1,500 crown or whatever you might charge in your office, that's their vacation to the Caribbean. That's what you're competing against. And dentistry is ultimately a need, not a want, right? Everybody wants to spend their money on that Caribbean cruise because they get something out of it that they perceive positively. Versus a need, nobody wants to go pay for, that crown unless they absolutely have to, or at least they feel like they have to. And so again, it comes down to what is the patient's perception of the problem. If they don't think they have a problem, if they don't think something is wrong, they're probably not going to say yes to their treatment, because why would they spend all that money on that service if they don't think it's going to benefit them? So we need to reframe how we talk to our patients, right? We should be focusing more on why should I care, right? As a patient, not necessarily as a dentist, right? Because we know all the benefits of what a crown can do for you, but the patient doesn't really understand that. So again, we kind of need to reframe how we go about that. And something I see commonly with new graduated dentists and even some more experienced dentists is sometimes we talk too much and try to over-explain to our patients. And this is a great way to confuse your patients. And, how many times have you guys heard, oh, let me think about that, which is more times than not a polite way of the patients just saying, I don't want to do this, and they don't want to just say no to your face. So ultimately, when we're within dentistry, there are 3 common barriers that we encounter when talking about what stops a patient from getting treatment, right? It's usually financial based, fear of like having pain, whether it's in the procedure or afterwards, or function. And when you talk to your patients about why they should do a certain treatment, you should cater some of your reasoning towards whatever this patient is worried about, right? So if your patient is worried about the finances and the cost of the treatment, instead of telling them that, again, that crown's going to cost, whatever it might be, $1,500, let's just say. I don't talk finances in my practice. I leave that to we have a front desk coordinator and our assistants. But again, I train my team to talk in payment plans instead of presenting the full fee, because that's a lot more digestible for the patient to understand that, $1,500 to the average person who lives paycheck to paycheck, that's a lot of money, right? Versus if you tell them that, you could do 10 payments of $150 or whatever the math would be, that's a lot less intimidating of a figure. Patients nowadays, they're doing payment plans for everything. You can get payment plans for your groceries. How many of you guys have an iPhone and did the payment plan instead of paying the full fee because it doesn't cost any extra, right? It's just easier and more digestible. So, cater to your patients in that way. Or if it's something along the lines of fear, if your patients are, how many patients hate going to the dentist? They're worried about the pain, whether there's actually going to be any pain in the procedure or not is a different story. But again, there's still that fear. A lot of people have that bad experience where they weren't numb. And so again, if you have an anxious patient who is worried about this as their main concern for not going to the dentist, reassure them, focus on how, you're going to make sure that they're very numb during the procedure, that they're not going to feel anything. And also, furthermore, talk about how, if they don't do this filling or this crown, that cavity is going to grow, it's going to reach your nerve, and now you're going to need a root canal, which is going to have a lot more postoperative soreness than if they were to just do the filling or the crown. And so again, it's focusing on these things with your patients will help get a lot more yeses, because ultimately it's what they care about. So some other things I like to do here to also help my patients say yes is analogies. I'm not a big fan of scripts because those are a bit hard to follow, but there's some terms that I like, some phrases that I like to use. And one of them in particular, as someone who works as a dentures and implants clinic, and we do a couple hundred dentures a year, I always like to set their expectations by telling them dentures without implants are more for smiling than they are for chewing. Now, what I mean by that, of course, patients are going to be able to chew with their dentures. But some patients, depending on how much bone loss they have, if they're, they may or may not be able to eat everything they want to. And so this is a great way to get their mindset and make them understand that ultimately, if I don't do these implants, then I may not be able to eat everything I want. Furthermore, I also like to talk about, crowns, open margins, right? Patients, a lot of times dentists will call, when they deliver a crown, it's a permanent crown, right? But the problem with that is that gives the connotation that it's permanent and is going to last forever, which unfortunately, nothing in dentistry lasts forever. And so a great way to reframe that is, I always say long-term crowns. But also, when I talk to my patients about these, when a crown gets a cavity, right, the tooth, there's a recurrent decay. I always explain it like it's like putting food in some Tupperware, but the lid isn't fully closed. What's going to happen to that food? It's going to go bad faster. And so then you can explain to the patient the crown is the lid, and ultimately that bacteria is going to get in there once the lid is, the seal is broken, and that's what's causing this cavity here. So again, always just to make your patients understand a little bit better. Another tool that I love using is photos instead of radiographs. In dental school, we're trained to, show your patients the x-rays, but it is very difficult to explain a patient, what's going on in an x-ray, right? We spend, however many hours trying to learn how to read x-rays, and your patients just trying to explain to them in under 2 minutes is pretty difficult. And so here's a great case where we had, you can clearly see that number 14 was sheared off on the distal, and that's why the patient came in, because they were in pain from that breaking. So you might be able to explain that to your patient because they can see that a chunk of the tooth is missing. But what you might not notice here is number 13 is also missing half that tooth. And, most of you probably didn't even notice that. But, imagine trying to explain that to a patient when you can't really see it, versus if you show a photo like this, where you can see that half their tooth is missing, it's a lot easier for the patient to comprehend that, oh, wow, I've been missing that. And this had been there for God knows how long. And then it goes back to what we were talking about earlier, right? The patient's psychology. What did the patient come in for? He came in for number 14 when it broke because it hurt. So again, when you're talking to this patient about number 13, you can talk to them about how, see how you broke this tooth off? If we don't address this as well, you see that brown stuff right there near the tooth? That's a cavity right there. And that cavity is going to reach your nerve and ultimately cause you more pain if we don't address this soon. Another instrument I like to use is artificial intelligence. I don't know how many of you guys are using artificial intelligence yet, but it is a fantastic tool for you guys, especially you practice owners who have newer associates that might have recently graduated. It's tough when you're going from, having tons of time to do your exams to, depending on how many chairs you run, I run 7 chairs right now, and it can be hard to keep up with everything. And I'm doing 3 to 4 exams an hour, and so this is just a great tool where it helps you miss less things, right? And your associates will notice more things. And again, artificial intelligence isn't perfect still. There's still got some improvement to go. But again, you can clearly see here on these like color-coded figures, where the cavities are. And again, it's just gonna, whether you would treat all these or not is another story, but again, it just helps your associates and yourself even make sure you don't miss these as much. And furthermore, for the patients themselves, this is a lot easier to digest than looking at an x-ray. Whether trying to explain them different like radiopacities and, is a lot more difficult versus if you're, have these color-coded figures. This speaks much more to the patient, right? You can explain to them that purple part is the nerve, and you see that red/pink stuff, that's all cavities right there. And can you see how close that red part is to your nerve? That's your cavity. That's why you're having pain, and ultimately that's why you need that root canal. So again, it's all just using different instruments to help make it easier for your patients to understand these terms. Now, another thing I'd like to talk to you guys about is setting proper expectations. And this really does affect your bottom line because unhappy patients, they're going to want their work redone, they're going to give you bad reviews, and again, all things that can lead to issues for your practice. So, oftentimes it's very tempting to overpromise, right? We want to convince that patient that whatever we're giving them is going to be great. But in reality, you're setting yourself up for failure because if you don't deliver, that's going to be an unhappy patient. So something that I've always stressed is setting the expectations lower, under promise and over deliver. Because if things don't go how you want them to, well, the patient was kind of expecting it. So again, dentures is always a good example. Denture patients are some of the hardest people to deal with. But so I always, again, make sure they understand that they're not going to be able to eat everything they want to potentially, depending on how much jawbone they have. Again, how old are they, right? Do they have the proprioception and the ability to chew? All these things will factor in on how I tell them like what they'll be able to do or not. And ultimately, everything you tell the patient beforehand, before you do a procedure, that's going to be considered an explanation, right? You told them ahead of time, they have that in the back of their heads, hopefully. But if you wait to tell them after that, oh yeah, hey, yeah, you may not be able to eat that steak that you always wanted to, that sounds more like an excuse, and that's ultimately going to lead to more unhappy patients. Furthermore, another thing that we often encounter as dentists is the whole, how long is this going to last, right? We hear that all the time. And this can be a tough question to answer because it depends on a lot of factors. But something I use to help reframe our patient's mind is I always compare and say, I'm not God, God made your natural teeth, and ultimately you just destroyed your teeth, whether it was with a cavity, you chipped your tooth, whatever it might be. So any filling, any crown, whatever that might be that I put in there is not going to last as long. And so it's going to ultimately depend on how we take care of it, and et cetera, et cetera. But what this does is it puts the onus back on the patient and makes them take some accountability, while also understanding that, this crown will ultimately have to be replaced in my lifetime, right? That fillings last, however long, right? So again, these are all just ways to help make your patients understand better. Alrighty, so now I'm going to talk to you guys a little bit about how to manage multiple chairs. And this is something that, new grads in particular really struggle with, because we go from running one chair, having very long appointments, to all of a sudden, we're doing hygiene checks, we're running multiple chairs, hopefully, and this can be a tough transition. But first, I always want to take a step back and figure out what your goals are. What do you want to take home for the year? What do you want to produce? Figure that out, and then reverse engineer everything. Make sure you're tracking it, right? If you're not tracking something, it's going to be very hard to figure out if you're improving or not. And so I have it written down, like what my daily goal is. I have my monthly goal, and I'm trying to constantly figure out why, if I'm not reaching it, what's going on. And if you're not reaching your goals, one of the best things you can do is adding procedures. But you don't want to just add something just blindly, right? You want to do it with reason. So something that's great to do is figure out what you're referring out the most of. You should be tracking your referrals. And so, if you're referring out a ton of ortho, then, doing some clear aligners and brackets would be probably a good investment, right? Because patients never like being referred out ultimately, right? They want to do whatever they can to stay in their practice. And so again, these are just some tools that you can use to help improve that. But now going back to the multiple chairs here, you have to figure out how much time you need for a procedure, right? Maybe you need an hour for your crown preps, or hour and a half, right? But then you have to factor in, okay, if I need an hour for my crown prep and I have something else next to it, and then I have 2-3 exams, how much time do I actually get to spend with that patient and in doing that procedure? So it's very important to figure out, your standard times for how much do you need in each column that you're running. So this is how my columns work. We have one high production, where it's about, if a case wants to be booked there, it needs to be over $1,000 case. We have a low production column where pretty much everything else goes. We then we have 3 hygiene columns, and then we have 1 removable column. As I mentioned, I'm a dentures and implants clinic, so we do quite a bit of removable. And we also have 1 emergency new patient chair. And this is how much time I get to delegate to each column. And so you can see there, if I'm doing an extraction and delivery, right, I'm only getting 20 to 30 minutes in the high production column to be able to really just, to do that procedure. So I have to have in the back of my head that I need a little bit more time, because ultimately I'm only going to get 20, 30 minutes of that hour to do the procedure. And so again, so here's a great example of 2 full mouth extraction cases I did recently. As dentists, you can tell that one is not like the other, right? You can tell that bottom case, those teeth are very perio involved. I pulled out a few of those teeth with my fingers, right? Versus that upper case, that's a much more intensive surgery. This patient, has all 32 teeth. They had, buccal exostoses, and so it was a pretty intense surgery. But your front desk and your assistants, they may not know the difference, right? So if you have just set standard times for all your procedures, this can cause some issues when scheduling, because you're going to run behind or you're going to have extra chair time. So when you're treatment planning, it's also very crucial that you're telling your assistant, your front desk, whoever it might be, that this is how much time I need for these appointments, right? So when I treatment plan, I break it down, how I'm going to break up the procedures, and then how much time I'm going to need. Now, of course, some procedures have standard times, right? Like when I'm booking a crown prep, I always book 75 minutes, right? But again, if I'm doing like if it's an upper second molar that's got like a large, buccal cavity, I know it's going to be a brutal procedure. I'm going to ask for an extra 15 minutes because there's nothing worse than doing something difficult and then having to rush through it. So these are all things that will just help make your schedule run more smoothly. Furthermore, when you're running many chairs like I'm doing, it's crucial that you take the time to educate your team. Take good care of them. Make sure they understand what you expect out of them. So when I'm doing, like for my hygienist, my hygienist is fantastic. She numbs most of my patients for me, and it makes my life so much easier because then I just can come into the room, I can go ahead and, just start prepping right away. And again, of course, this all has to be within what's legal within your state because I know not all states allow hygienists to numb. But if it is something that you're allowed to do, it's something that can really make your day go much more smoothly. And also, maximize your assistants, right? Teach them to pack cord if it's legal in your state. Have them make your temporaries, take your impressions and scan and whatnot, right? This is just freeing up more doctor time. Your time is the most valuable, and it is the most difficult to, ultimately free up your time, right? That's usually the limiting factor 9 times out of 10. So again, anything you can have them do for you, you should be training them for. And most importantly, reward them, right? Take good care of your team. Everybody knows how difficult it is to be, short-staffed, and if you don't take good care of your team in today's world, they're going to move on from you pretty quickly. Now, another thing that we have added to our practice that has really just changed our, paid dividends is doing an emergency chair. So we have one column designated to emergency patients. This is a great way to get in new patients very quickly. Also, a patient in pain is very easy to get them to say yes to whatever you need to do, right? They're already experiencing the things that you're normally warning your patients about. So they're going to be more likely to say yes. And, if you have any cancellations in the day, this can be a great way. If you can do the same day dentistry, it'll bring up your production again. And also, emergency patients can be some of the best patients. I know sometimes they can be a little flaky, but if you can convince them and get them committed to being a comprehensive patient, these tend to be the patients that ultimately have the most, have high cavity rates, right? Because they don't go to a dentist regularly. They're just waiting for pain to start. So they usually have a lot of other issues going on. And also they're going to be very happy and grateful for what you did for them, right? You took away their pain. You did a service. And again, we always set the expectation that it's just an exam, and because, with how our practice runs, a lot of times we don't have time to do the procedure unless there is a cancellation. But again, this just sets their expectations that, hey, I may not get the treatment, but I'll get the exam, and we usually get them in within a day or two. But again, if you can get them in the same day, this is just going to make them that much more thankful for you. Alrighty, guys. Well, thank you guys all for listening in today. I'm very thankful for you guys tuning in. Hopefully you took a few things away from here, including, making sure that you keep it simple, right? When you're talking to your patients, don't overcomplicate it. Don't use dental jargon, and focus on what they care about, right? Figure out what is that patient's pain point. Is it their wallet? Is it, the fear of the pain of the procedure? And, whatever it might be. And, again, maximize your production. Utilize your team fully. Take good care of them. Teach them whatever you can, and use them to their full abilities. So, again, here's my contact information. If any of you guys want to connect, I would love to chat with you guys. If you have, I'm happy to, chat over your schedule, talk about how we can improve your efficiency. If you're an owner doc looking to get your associate producing more and figuring out ways that you can make it easier for them, I'm happy to talk about how some ways that you can do that. Otherwise, thank you.